Hello. So, as EMS professionals, we're not just ambulance drivers. Either while on scene or while en route to the hospital, we're going to be actively treating our patients. Sometimes these treatments involve administering medications to our patients. There are a variety of different ways and routes that medication can be administered, one of which is through IV access or intravenous access. As the name suggests, intravenous access involves making access to the patient's veins and administering the medication directly into their bloodstream. Today, we're going to be discussing establishing IV access with a saline lock. The saline lock is an alternative that you can use when not administering IV fluids to the patient through IV tubing. I want to mention that this is an ALS skill. Only perform this skill if it is within your scope of practice. We don't want anybody operating outside of their scope. That's a no-no. So now let's get down to business. The first thing you want to do before performing any procedure in any EMS skill whatsoever is make sure that you have all your supplies prepared. Before you begin any procedure, you want to make sure that you have all your supplies ready and prepared. So right here we have our gloves, our PPE. We have our different IV catheter sizes. We're going to have our saline flush, our alcohol prep. We have some gauze, Tegaderm. We have tape, a tourniquet, and our IV extension set. So your catheter sizing on IVs can be a little bit confusing. 14 gauge, for instance, is your largest catheter, but it's actually going to be your smallest number. Whereas your 24 gauge is going to be your smallest catheter, but your largest number. There's going to be a variety of factors that are going to go into selecting the appropriate catheter size. Some of the factors that are going to include the patient's anatomy and what the IV is going to be used for. For example, if you have a small adult or a child, you're most likely going to need a smaller catheter size, a 22 or 24, whereas if you're on a larger adult, they can handle a 20 or an 18. Additionally, you're also going to want to think about what the IV is going to be used for, right? So is this just going to be for medication administration, or is it going to be used for some sort of procedure? An example of this would be if a patient is going to be undergoing a CT and they're going to require IV contrast dye, you're going to want a larger catheter. Also, you're going to want a larger catheter, or what we call a large bore IV, for critical patients that might require some fluid resuscitation. The catheter size is also going to affect the flow rate of if you're hanging any IV fluids or anything like that. So now that we've collected all the supplies that you were going to need for this procedure, we're going to also make sure that all the supplies that we have are in date, and we also want to make sure that they appear to be in good working order, so nothing appears to be damaged or anything like that. Once you've checked all your supplies, made sure you have everything's in date and in good working order. Now we're going to start the actual procedure. First thing in any procedure, you want to make sure that you have your proper PPE. For this particular procedure, we're going to be using gloves. This procedure is going to involve bodily fluids. We want to make sure that we're being safe. I always like to remember, if it's wet and it's warm and it's not yours, don't touch it without your proper PPE. So now we've got our PPE and we have all our supplies. I'm going to go ahead and start preparing for our procedure. Make sure I get my PPE on. Now that I've applied my PPE, I'm going to start prepping. While I understand that EMS, it is hard to maintain sterility, just as the nature of the game. However, you want to try to remain as sterile as possible. So first, we're going to prep our extension set and our saline flush. This is going to be the saline lock part of our IV with a saline lock. So we're going to take our saline flush, open it up. I like to get all the air bubbles out first. All right. Now that we have that, we're going to set that to the side. We're going to open up our extension set. On the end of our extension set is going to be a little cap. We're going to take this and we're going to sit this down. We're going to keep that close to us. We're going to open up our saline flush. We're going to connect it to the end of our extension set, and we're going to flush through our extension set, just making sure that there is fluid all the way through. We don't want to give patients any air embolisms or anything like that. Once we have prepped that, I like to place it back in the packaging. And again, we're going to sit that off to the side as well. Now we're going to go to our patient. We're going to start prepping our patient. So today, like I said, we're starting an IV, but this is also going to be a peripheral IV. And by peripheral IV, we're going to go from the periphery, i.e. the extremities. So for the sake of demonstration purposes, we're going to use this arm. When starting an IV, you want to typically start from the bottom down when you start looking for veins that you're going to start your IV in. That way, if you, for whatever reason, are unsuccessful with that IV, you can go above that site to try again. So when you're going to begin looking for an IV, you're going to take your tourniquet and you're going to apply it to your patient. So now we have our tourniquet on our patient. Now we're going to start palpating. So when you're palpating for a vein, you want to feel it's going to be kind of bouncy. We have one right here. It's going to be pretty bouncy. And this is going to be the vein that we're going to cannulate with our IV catheter. So like I said earlier, before you go ahead and start your IV, you want to make sure that you're choosing an appropriately sized catheter for the vein. For this particular vein, we're going to do a 20 gauge IV. Once you've selected your vein that you're going to be using and you know what catheter you're going to be using, you're going to open your IV catheter up. So I have my catheter here. You still have your extension set with your flush prepared beside you. You're going to take your alcohol prep. You're going to open your alcohol prep and you're going to cleanse the site. You're going to do like a circular motion, working your way out. After you have cleaned the site, you don't want to touch it again. You don't want to fan it. That's going to cause contamination. We don't want any infection or anything like that. So we've cleaned the site. We know what site we're going to. We have our IV catheter. So now it's time to insert the IV. So now that you've cleaned and prepped your site, you know which vein you're going to be starting your IV in. You're going to open up your IV catheter. When you open up your IV catheter, you want to be sure this is a sharp. Don't want to stick yourself. You want to make sure that you have the proper grip when holding the catheter. So you're going to hold the actual catheter with your thumb and your middle finger, and you're going to use your index finger on the actual catheter. So the thing about the IV catheter is that it is a needle, and then there's the catheter on top of the needle. The catheter, the flexible plastic catheter, is what's going to actually stay in the patient. The needle is just kind of used to make access. So you're going to use that index finger to advance the catheter once you have accessed the vein. So you have your grip with your thumb and your middle finger. You want to take your other hand and you want to hold traction on the vein. You want to make sure that when you go to insert your IV, you're going to use the bevel up. So you're going to take your bevel, hold traction. You're going to approach distal to the vein, and you're going to come in at a very shallow angle. And then you're going to advance into the vein. You will typically feel like a little pop, or you'll feel like the lack of resistance, should I say, once you've actually breached the vein. I would advise just to advance just a little bit more, just to ensure that you're in there. Once you're in, also on a live human, obviously I'm not using a live human, but on a live human, you will typically see a flash of blood. Not all the time, but most of the time. That's also another really good indication that you have actually accessed the vein. So once you've accessed the vein and you've gotten that flash of blood and you've advanced just a little bit further, you're going to take your index finger and you're going to advance the catheter into the vein, just like that. While you're advancing the catheter, you're also going to be pulling the needle back. You're going to hear a click. This particular needle is has a safety guard on it, so you're not gonna have a sharp, but you do want to make sure that you place this in your sharps container. On the actual vein, you're going to want to hold pressure above where you've inserted the IV. This will kind of occlude the vein. There are some IV catheters that are self-occluding, some that are not. It's always a safe practice to go ahead and occlude whether you know it is self-occluding or not. So once you have established the IV, now you're going to take your extension set. You're going to remove your end from the extension set while still holding your occlusion, while still occluding. You're going to connect your extension set to your IV catheter. At this point, you're going to remove the tourniquet from your patient. Once you have removed the tourniquet from the patient, I like to pull back and make sure that I have blood return. Sometimes you will get blood return, not all the time, but that is also another really good indication that you have established the IV. And then you're going to flush your saline to ensure that your IV is good. Now, as long as your flush is good, you don't have any resistance when you flush, your patient's not complaining of any pain, there's no swelling noted, anything like that. You can remove your flush from the tip of your IV extension set. You can also add that cap that we set to the side earlier. We can place that back on our catheter. Again, we can't guarantee any sterility, but we want to try our best. So we have our IV inserted. We're going to take our Tegaderm that we had earlier. We're going to open our Tegaderm. We're going to place the Tegaderm on top of the IV. This is going to keep it in place. Then we're going to take our tape. We're also going to tape it down. Depending on the provider that you ask, providers have different ways that they like to tape their IVs down. But typically I like to put one on the bottom where the IV catheter and the extension set connect. And then I like to pull my extension set up and tape it down as well. Then because I am not giving anything right now, I don't want to keep the extension set open, so I'm actually going to clamp it off. And there we have it. We have our IV established. As I stated earlier, you want to make sure that you put your sharps in your sharp container. We don't want any sharps around. We want to make sure that everyone stays safe. After you have established the IV, you're free to administer any medications that you need to. While you have your IV on your patient, you want to make sure your patient's not complaining of any pain, any burning, no swelling is noted, anything like that. You want to make sure that you go ahead and pull the IV. We don't want to play around. We don't want to cause any cellulitis. We don't want the IV to be infiltrated or anything like that. And just kind of monitor the patient, as you should anyway. So now that your IV has been established, you're ready to give any meds. You also have the equally important part, the documentation of it. So in most of your IV start kits, there's going to be this little sticker in there as well. That sticker, you can record who started the IV, the date and the time that it was started, the size of the IV, and sometimes you can also describe where the IV was started. In addition to documenting the IV on the tag, you would take that sticker and actually stick it on the IV, normally on the Tegaderm somewhere beside the IV. You also want to make sure that you're documenting the IV properly in your charting software, in ESO or EMS Charts, whatever that you're using. Want to make sure, again, the time, the date, the person who started it. Sometimes it'll also ask if there were any complications. That would be the place that you would dictate that as well. You also want to make sure that you're documenting any unsuccessful IV attempts. Like I said, you want to make sure that you're documenting any unsuccessful IV attempts. Like I said earlier, when you're starting your IV or looking for a preferred site to start your IV, you want to typically work your way from the bottom up. So if you're looking at the arm, you want to start at the hand and then kind of work your way up. Everybody kind of likes to go straight to the AC, but just know that if you're unsuccessful with that, you kind of lose real estate on where you can go above that IV if you need to try again. Earlier, you want to make sure that you're constantly reassessing your patient. Anytime you're pushing any medications or you're starting any fluids through that line, you want to reassess. Again, make sure there's no swelling, make sure the patient's not in any pain, it's not causing the patient any discomfort. If it is, you can sometimes try to troubleshoot, or, sometimes it is just best to just go ahead and pull the line just to be safe. So some other important information you want to make sure that you're aware of when starting your IV is that for whatever reason, if you have inserted your IV catheter into your patient, and for whatever reason you started advancing your catheter and something's not going right, you never want to reinsert your needle into the catheter. When you reinsert your needle into the catheter, it can cause like a sheathing effect almost, and it can cause microplastics to come off of the inside of the catheter, and that can actually be left inside the patient's veins, and you don't want that. Something that we really don't want. Again, we want to do everything we can to make sure the patient's comfortable, do what's best for the patient. And with that, we've gone over the basics of how to establish IV access, and now you're ready to try it on your own.